There is a stigma around STIs. Even with perfect hygiene, people are still getting UTIs. Especially Black women have been subjected. They've been used, they've been studied, they've been cut open and experimented on without consent. Period pain is normal, but period pain that interferes with your daily life is not. What if the reason you haven't gotten answers isn't because your body is broken, but because the system was never built to listen to you? Welcome to G Chats. Hi guys, welcome back to G Chats. We are here in the G spot as usual with your biomedical engineering big sister, me, Gianna Jara. In today's episode, we are going to be talking about the pelvic floor and pelvic health because I personally think that it's something that doesn't get nearly as enough attention as it deserves. I think a lot of people, when they think of pelvic health, really only think about child labor and delivery and what that does to the body. And they're like, oh yeah, then that's when you need pelvic floor therapy, which yes, I agree. And you know, the shitty part with that is it's not always covered by insurance, even after labor and delivery, which is so unfortunate because I think it's so important for people who just gave birth. And I think insurances should cover it widespread. But I don't think that that's the only time that someone needs pelvic floor therapy. Now, I do want to say, like, across the board, regardless of your gender, pelvic floor therapy is so helpful, literally for various different things that someone is struggling with. Like, you could be struggling with constipation and that can impact your pelvic floor, whether you're a man, a woman, or anything in between. It literally doesn't matter. But in today's video, obviously, because female reproductive health is my niche, I want to talk about pelvic floor therapy and pelvic health in relation or in context to the female body and certain instances where it's beneficial. So I do have notes that are prepared. This is an area that's not discussed enough, that if you are someone who's dealt with burning, painful sex, recurrent UTIs, chronic urgency, constipation, bacterial vaginosis, all of these things that just like keep coming back, unexplained pelvic pain, or you've simply been told that everything looks normal, but you don't feel normal, then I want you to know that today's episode isn't about telling you that your pelvic floor is causing all these symptoms, but it might be participating in your symptoms. Because one of the biggest mistakes that I see in female reproductive health care is that we separate the body into completely different specialties. And it's so frustrating to watch. The urologist looks at the bladder. The gynecologist looks at the vagina. The gastroenterologist will look at the gut. The orthopedist will look at your back. The psychologist looks at trauma. The physical therapist looks at movement. Like, this is just literally all these different specialties. Meanwhile, your body doesn't recognize any of those boundaries. Your body is not breaking these things up into different areas and different specialties. So your pelvis is where all of those systems meet. Every single one that we just talked about, they meet right there in your pelvis. So today, I want to explain why. So let's start very simply with what is the pelvic floor. Let's get to the basics. The pelvic floor is not one muscle, right? I think a lot of people think that it is, but it's actually an entire group of muscles, ligaments, connective tissue, fascia, and nerves that sit like a hammock. For a lack of a better example, it's really like a hammock across the bottom of your pelvis, and they all sit there. So imagine the bottom of your pelvis as a bowl, and the pelvic floor is the sling that's holding everything inside of it, which is why I said it's like a hammock. So it supports your bladder, it supports your uterus, your rectum, it helps control urination, it helps control bowel movements, it contributes to sexual function, it contributes to orgasms, it stabilizes your core, it even assists in your breathing, literally. When people think the pelvic floor only matters after childbirth, we've already missed the bigger picture. This structure is working every single second of every single day. And not enough people know that. So the pelvic floor is supposed to move. Seems crazy, but one misconception that I hear all the time is that women need to strengthen their pelvic floor. Maybe that's true. I don't want to say that that's never true. Maybe they do, but not always, because healthy muscles do not stay contracted. I'm always seeing people talk about, you need to do Kegels, you need to strengthen your pelvic floor. Sometimes there are people whose pelvic floor is too tense and too tightened, and it doesn't know how to relax. Healthy muscles, like I just said, don't stay contracted all the time. Healthy muscles contract and relax. So think about your bicep, for example, right? If I ask you, and we'll do it together, to flex your arm, right? But I tell you, do this 24 hours straight, eventually what's going to happen? It's going to hurt. Your arm's going to give out. It would become weak. It's going to fatigue. No, that's what would naturally happen. If I told you to put your hand in a fist and do it for 24 hours, like just squeeze, it's going to fatigue. It's going to cramp. It's going to get tired. It's going to go weak. The pelvic floor is exactly the same. Many women don't actually have weak pelvic floors. Instead, they have pelvic floors that never fully relax. And this is called pelvic floor hypertonicity. And those muscles stay guarded, almost like they're constantly bracing. And that constant tension changes everything that's happening inside of your pelvis. And I am someone who struggled with this. Now, I left a blank spot in my notes to very candidly share my experience. So I want to give you guys a quick little rundown of what I experienced. So many of you already know this. I struggled with recurrent UTIs pretty much my entire early adulthood. It was one UTI after another after another. And what I noticed is I could not sit on the toilet and relax to pee. Every single time that I went to the bathroom to pee and I would get up, I would feel like I need to pee again. I had a bladder scan done once where I was told, come to the office, the doctor's office, with your bladder full. Like, you need to go. Like, you want your bladder to be full. Show up with it full. We're going to scan it while it's full. Then we're going to have you go pee. And then we're going to have you come back and sit under the scan, and we're going to scan it to see if you're emptying properly. And guess what it revealed? I, Gianna Jara, your biomedical engineering big sister, was not emptying my bladder properly. I was not, and it was because my pelvic floor muscles were always tight. They were constantly bracing, and you know what they were bracing for? For trauma. For a UTI. My body had become so used to experiencing UTIs that peeing was a frightening and traumatic experience for me. So I would go on the toilet, pee, and then like tighten up. A lot of people don't know this, and I don't know if this is the same across the board for everyone, but for me specifically, how I know and how I always knew when I was having a UTI is the entire stream of my urination would be fine. But at the very end, it would pinch. And that was the sign of a UTI for me. That pinching sensation would send my entire pelvic floor into a state of shock, a state of trauma, a state of fear, because it's one of the worst pains I've ever experienced in my life. I would say my menstrual cramps and UTIs are up there, like neck and neck of worst pain I've ever experienced. And I'm almost 90% sure, if not 100% sure, that the only thing that's going to top that is likely going to be childbirth, or if something serious ever happens to me, like an accident where I'm breaking all these bones. In my life, my menstrual cramps and urinary tract infections are up there with the worst pain that I've experienced in my life. And it would pinch at the end of my urination, and that pinch would like make my legs go numb. It would make my whole body, like I would start aching in my pelvic floor just from that pinch. My entire body would start aching, and it was very traumatic. So even after I would start taking the antibiotics, I was just so fearful of another UTI. I was so fearful of that sensation, that burning sensation, that feeling of a UTI, that my body was always bracing for it. And it really only took maybe 4 or 5 UTIs for my body to say, like, I'm horrified, especially when they keep coming back, right? The first one happens and you think infections are simple. You get an infection, a bacterial infection, you take antibiotics and it's gone. It's just like when you were a kid, when you had strep throat, or you had an ear infection when you were a kid. You get the medication, you take it, and then you're fine. And everything goes back to normal. Life goes back to normal. But after a few UTIs, life didn't go back to normal for me. Life was different. Peeing was different. I remember in college talking to my friends in the library and saying, like, peeing is such a horrifying experience. There was actually one of our guy friends who was like, that sounds so miserable, because peeing is quite literally one of the most relieving experiences someone should have. And I was like, no, literally peeing is traumatic for me. Like, peeing is horrifying. Peeing is uncomfortable. I also would send myself into this place where every single time that I was urinating, if I was dehydrated and it burned, I send myself into almost like a psychosis of I'm having another UTI. I cannot tell you guys how many times I rushed myself to the ER because I thought I was having a UTI, gave a urine sample, and then after a few hours was like, oh, wait, I'm fine. It's not a UTI. And then guess what? The culture comes back that it's not a UTI. I wouldn't take any medication or anything. If I literally had a burning sensation, that was it. To me, I was having a UTI. And that is such a horrifying place to be in because the loop continues. You reaffirm to your body that you're always going to be sick. A lot of people don't know, and we'll talk about this in the video. I have it prepared in my notes, that your pelvic floor really holds so much stress, trauma, and story. And one of the things I learned in pelvic floor therapy is rewriting that story, because your mind creates this feedback loop to your pelvic floor of, hey, wait, yeah, I am always going to get a UTI. I can't travel without getting a UTI. My body is going to let me down. My body is going to betray me. That was the story that I created for myself. And that's because I was living through it. When I was going through pelvic floor therapy, not only was it, we got to get your muscles to loosen up and we want it to relax. Like, obviously we want you to contract, but your muscles are doing that way too often. We want you to relax. And the best way that you're going to relax is if we can hone in on that stress, that trauma, and that story. And that was influential. And one of the best things that my pelvic floor therapist taught me was you could do as much pelvic floor therapy as you want. But if you guys aren't watching and you're just listening, if this, and what I'm pointing to is your brain, your mind, if this is not safe, your body won't be safe. So your mind has to be safe as well. Your mind and your brain has to believe that you're safe. And no matter how much pelvic floor therapy that you do, your body won't feel safe if your mind is telling you that you are not safe. And that was something that I had to learn. I had to rewrite this story, and I had to do this pelvic floor therapy and do things that I never thought I would do to tell myself, you are safe. One of those things, actually, for a while, I used to travel every single time that I was traveling. And you guys already know this. I worked as an engineer while running my business. So while I was working as an engineer, I did travel a little bit. And every single time that I did travel, I would pack in preparation for a UTI because I had convinced myself that I'm going to get a UTI while I'm away. I convinced myself that. So I had like an emergency kit, which I don't want to say is not important because even now I do have a little bit of like an emergency kit that I keep with me just in case. But the story is different because in the past it was, I'm going to get a UTI, so I need to have X, Y, and Z with me just in case. Now this is supportive. I have this with me so that I can have peace of mind, but it's not me setting myself up that I'm going to have a UTI. And so one of the things that we had to work on is I went on vacation to Belize in 2024. And when I went, it was my first like real vacation in my life, like in my adult life. I went one time when I was like 4 years old on vacation with my family, but I don't remember it. This was the very first vacation that I ever went to in my life. It's with my boyfriend, Daniel. We had such an amazing time, but I was horrified of being in another country. I was in Belize and I was like, I'm going to be in another country. What if I get a UTI? Like, I was absolutely horrified. So guys, when I tell you I packed like D-Manos, Hiprex, vitamin C, like I was packing like in preparation for a UTI. My pelvic floor therapist and I were working together, and basically like the resolution we came to is you can take what's necessary as like a precaution, but you packing all these things and convincing yourself that you're going to get a UTI is not going to break the cycle of your body feeling safe because your mind is telling your body that it doesn't trust it. And so one of the things I had to do was literally not pack all of that stuff. And I can't tell you how anxiety inducing it was. I was so nervous. It was very scary for me to do that. I'm like, what if I get a UTI? Like, I was so upset. I was stressed. I was so stressed. But once I did it that one time, then I've been to San Diego, I've been to LA, I've been to Dallas, I've been to Cabo. I traveled so much after Belize, and every single time I take like D-Manos with me as like supplementary, but I'm not taking emergency stuff. I'm not taking Hiprex. I'm not taking antibiotics with me. I'm not calling my doctor asking, hey, can you prescribe me antibiotics just in case? Like, I'm not doing any of that. I'm literally taking D-Manos with me, or like honestly with Clarity. It has cranberry in it. It has enough of the PACs that's going to cleanse and protect the urinary tract That's all I need. Like, I don't need anything else. I'm fine. So after that, I was able to break the story. And oh my God, traveling just became so much more fun to me. It wasn't a miserable, scary thing. So that was a really long monologue of like my experience. But I just wanted to be transparent that I've experienced this. I went through it. And that is why I feel like it's so important to talk about it. Okay, so on that note, let's talk about why muscle tension can mimic an infection, which is what I was constantly experiencing. So many women like myself experience urinary burning, urgency, frequency, pain with intercourse, vaginal burning, vulvar pain, tailbone pain, hip pain, lower back pain, and are repeatedly tested for infections. And everything always comes back negative. They're told that they're just anxious or that everything like looks normal and there's nothing wrong. But muscles themselves can create these symptoms, which I didn't even know until I started doing pelvic floor therapy. And when muscles remain contracted, blood flow decreases and nerves can become compressed and inflammatory chemicals begin to accumulate and pain signals become amplified. So the pelvic floor surrounds the urethra, it surrounds the vagina, it surrounds the rectum, and the irritated muscles can then create sensations that feel remarkably similar to an infection. So that doesn't mean that the infection isn't real. It just means that muscles can produce similar symptoms, and sometimes both things can exist at the same time, which makes the experience even more traumatic, because then at that point, you never know when you're having an infection, like especially when you're actively going through recurring infections, you then like don't even know what's real and what's not real. That's where I want to talk about and highlight the pelvic floor and the vaginal microbiome and that connection, because it's one of my favorite topics to discuss because I feel like nobody talks about it, and it's the vaginal microbiome. And people often think that bacteria exist completely independently from everything else that's happening in the pelvis, especially when we talk about the vaginal microbiome, but they don't. So I want you guys to think about what healthy vaginal tissues require, right? So when you have a healthy vaginal tissue, it requires good blood flow, healthy immune function, normal hormones or like balanced hormones, adequate lubrication, healthy epithelial cells, balanced pH, and all of those things are all influenced directly or indirectly by circulation and nervous system activity. To be clear, we don't have evidence that a tight pelvic floor or tight pelvic floor muscles directly cause bacterial vaginosis. But what we do know is that pelvic floor dysfunction can contribute to painful intercourse, incomplete bladder emptying, urinary symptoms, constipation, and chronic inflammation. And those changes influence the local environment that women are living in every single day. So it's another reminder that vaginal health isn't just about bacteria, it's the ecosystem surrounding that bacteria. And sometimes if you're not capable of fully emptying your bladder, guess what? That can contribute to having an actual urinary tract infection. And when you take antibiotics for the UTI, that can mess with the vaginal microbiome. Then bacteria can take over, like Gardnerella. You can start having those symptoms. Your pelvic floor tightens some more. Then you don't know if it's another UTI or you're having BV. You think it's another UTI. And it's just this like endless cycle of symptoms, and it becomes just so difficult to figure out what's going on. And the same can be applied to constipation, because constipation changes everything. And I feel like nobody connects the dots about constipation because the rectum sits immediately behind the vagina. What I want people to imagine like in their brains is if you put your hand on your lower belly right now, the thing that you should be pressing on, or what most people will feel, is their bladder, right? Especially if you have a full bladder. Your bladder's in the front, then behind that is your vagina, the vaginal canal, and then upwards like into the uterus, and then behind that is the rectum. So the rectum is the back part of everything. When we're talking about constipation, if stool is constantly retained or held inside of the rectum, and if someone strains every day trying to get it out, if bowel movements are incomplete, like you get some of it out but not all of it, guess what? The pelvic floor becomes even tighter. So constipation then also increases pressure throughout the pelvis. So it changes the biomechanics of your pelvis. It changes the bacterial exposure. It changes how women empty both their bladder and their bowel. A lot of people think like it's just about emptying their bowels. They think constipation just affects the rectum, but changing the biomechanics of your pelvic floor literally then alters the biomechanics of how you urinate, those signals to your brain, which is why I tell people holding building in your urine not only is just not good for your bladder health, but it's also not good for the signals from your brain to your bladder. It messes with that communication and that signal. So the gut, pelvic floor, bladder, and vagina, they're all neighbors. And when one struggles, the others frequently notice as well. And that's a problem that nobody talks about. And that can create trauma in itself, or on the flip side, trauma in general from your life can live in your body. So this is another thing that I want to talk about because I'm very passionate about this. I feel like a lot of modern scientists kind of reject this idea and this concept, but trauma, in my scientific opinion, and I know that a lot of scientific professionals will agree with me, especially pelvic floor therapists, which some doctors don't even believe in pelvic floor therapy, but my belief and what the science has shown me, and I lived this experience, is that trauma isn't only psychological. Trauma is physiological. Our nervous system evolved to protect us. And that's something that's not discussed enough. So when your brain perceives danger, muscles will contract. Your shoulders will rise. Your jaw tightens. Breathing changes. Hands clench. The pelvic floor is no different. And that trauma can come from sexual assault, chronic pain, chronic infections, emotionally abusive relationships, difficult childbirth, invasive medical procedures, years of painful infections, or simply living in a prolonged state of stress. The body often then responds by guarding itself. So sometimes women don't even realize that they are clenching, and I was one of those people. It has become their baseline. The nervous system has essentially decided that staying protected feels safer than letting go. And so that doesn't mean that the trauma is all in your head. What it means is that your nervous system learned a survival strategy and your muscles have listened. Like for me, what I notice is like if I'm standing at the kitchen and I'm like washing a cup that I just used and I like drank out of it. But sometimes I have to like check on my butt cheeks. I'm standing there and I'm clenching them and I'm like, ooh, sometimes I have to tap on them, like knock, knock on my cheeks to loosen them up, to get them to relax because they're constantly clenched. That is a response, a trauma response. My pelvic floor is in the state of guarding and survival. So sometimes we need to get our muscles to rewrite that story. And that's where I want to talk about stress, because stress affects more than just your brain. When we're stressed out, cortisol changes, your adrenaline changes, your breathing changes, blood flow changes, muscle tension increases, sleep will worsen, inflammation increases, pain sensitivity increases, the nervous system becomes more vigilant. This doesn't just affect your thoughts. People just think like stress just makes you like out of it and makes you lose your mind, but it affects tissues. It affects healing. It affects recovery. And stress is biological. It is not something that's imaginary. So it can literally impact your pelvic floor in ways that you've never imagined, which is why I love talking about how societal stress, like pressures that have been put on different communities in society, how these systemic stressors have affected different groups of people, particularly like the female population. So I like to do a lot of research in public health in regards to how the societal stressors that society created and has placed on Black women are physiological things that end up happening to the body. Like the stress then impacts them. It's kind of a proposed theory of, is this why Black women tend to have higher cardiovascular disease risk than a white woman? Is it because of that societal stress, the stressors, the day-to-day stressors? And when we're talking about stressors, we're talking about racism. We're talking about redlining. We are talking about poverty issue that affects the Black community because of redlining, because of the systemic racism that is built into the United States. And honestly, if we're being honest, globally. And a lot of people don't even think about that. A lot of people are ignorant and don't realize that racism can absolutely be a stressor that impacts Black women, for example. I always found that was fascinating, and that is why I always like to emphasize that stress is biological and it's not something that you're just imagining. So on that note, I want to talk about posture, because most people don't even realize that posture changes pressure inside of the abdomen. So think about someone who spends 8 to 10 hours a day sitting. I'm someone now as a biomedical engineer who's running a business. I'm sitting a lot. When I'm sitting, your shoulders are rounded, the pelvis is tucked underneath, your core is in inactive, your glutes are inactive, your hip flexors are shortened, and all of that changes how the pelvic floor has to function. So the diaphragm, the abdominal muscles, your pelvic floor, and the deep spinal muscles all work together. And when one changes, the others compensate. So even your breathing matters in this case. The diaphragm and the pelvic floor move together. So as you inhale, the diaphragm descends and the pelvic floor naturally lengthens. And as you exhale, they rise together. So shallow chest breathing can reduce that natural movement. And again, this doesn't mean that posture causes pelvic floor disorders. It just means that movement matters and breathing matters, and our bodies were designed to move. Really quickly, what I want you guys to do, and do this exercise with me. I want to stay near the mic so that you guys can watch what I'm doing. If you're watching this, take a hand, your right hand, put it on your chest, and then take your left hand and put it on your lower abdomen, like below your belly button. I want you to breathe in. One more time. Do you notice what's moving? Okay. So tell me when you breathe in, what moves, your chest or your lower belly? When I first started doing pelvic floor therapy, this is what my pelvic floor therapist told me to do. And when I first did it, guess what moved? My chest. It was almost like my chest went out, but my pelvic floor went in. My abdomen went in. The opposite is supposed to happen. When you breathe in, your lower belly is supposed to expand. The air is supposed to go down and deep into the pelvic floor. That was something that was not happening for me. That is called diaphragmic breathing. I did not know how to do that. I felt like my entire life I didn't know how to do. And I think a huge reason why I didn't know how to do it was I was taught from a very young age to suck in my stomach. And that's something that I feel like a lot of women have to deal with, where we're taught like you shouldn't have a belly, your belly shouldn't be sticking out, blah, blah, blah. So we're taught like suck it in. And so for me, I didn't know how to relax my pelvic floor. So now when I breathe in, this is what I do. I breathe in, belly expands, and then I breathe out. And I think of my pelvic floor as like a zipper, and it zips up as I'm breathing out. So in, out, and the belly zippers in. The belly zippers in. That's what you need to do. You need to focus on your pelvic floor. I was in a car accident before in the past. It wasn't like a very bad car accident, but I found myself that every time I was driving, I was just like nervous and anxious, and I would be so tense while driving. I started every time like I felt that anxiety and I was self-aware, I started doing diaphragmic breathing. While I was at like a light, I would put my hand on my chest, or not even on my chest, but on my belly, and breathe in and expand the pelvic floor. Get the pelvic floor to expand. I'm like, okay, I'm good. And I kept practicing that, and I would do that. Child's pose is another great way to open up those hips and get the breathing down into your belly. So next I want to talk about how pain changes the nervous system. This is something that I wish more women knew, because pain itself can become learned. And the longer that pain will persist, the more sensitive the nervous system can become. And eventually, even normal sensations may begin to feel threatening. So this is one reason chronic pelvic pain requires such a multidisciplinary approach, as I talked about, like mental health therapy and all of these things, because sometimes we're treating tissue, sometimes we're treating muscles, sometimes we're calming an overactive nervous system, sometimes we're treating the mental health, and often we're doing all of these things simultaneously. So it's not just about one of these things. Sometimes it's a collection of all of them. And the thing that's like very confusing is that normal sensations, and one of the normal things is like when you travel, you're not drinking a lot of water. So it's normal to be a bit dehydrated, or just not even dehydrated, because I feel like people use that term loosely, but it's very easy to become parched and not be taking in your usual water intake. I'm someone who drinks like an entire liter, if not 2 liters a day. And when I travel, obviously, I don't drink that much water. I'm not drinking that much. And so because of that, because I haven't drank all of that water, my body notices that change. And while that change is normal, like obviously one day of not getting my water intake is not going to make or break my health. It's a normal physiological change. My body is like reacting to not getting its normal water intake. That yes, my urine can become a little more acidic and it might burn in the morning. That is normal. But I can take that normal pain, like that normal normal physiological problem and turn it into a threat. And that's something that then my body senses, and the chronic pelvic pain that I'm feeling becomes a multidisciplinary approach, because we're treating the muscle, we're treating the story, we're treating the tissue, we're treating all these different things. So that brings me to pelvic floor therapy, and highlighting that pelvic floor therapy is so much more than just Kegels. When people hear pelvic floor therapy, I'm so sick and tired of them imagining someone doing endless Kegel exercises, because that's actually one of the biggest misconceptions. Many women with overactive pelvic floors should not be doing more Kegels. Pelvic floor physical therapy often includes breathing retraining. That is something like what we just did. Retraining how you breathe, the hand on the chest, hand on the abdomen. That is the first thing that we did my very first day in pelvic floor therapy. So it's about relaxation, manual therapy, scar tissue work if you have some, movement retraining, hip mobility, core coordination, bladder habits, bowel habits, education, nervous system regulation, sometimes strengthening, and sometimes learning how to stop strengthening. So it's individualized. All of these things can be true. Some of these things can be true. One or two of these things can be true. But this one size fits all of do more Kegels is not true. It's a collection of all these different things, and it really is an individualized approach based on your story and based on what your symptoms are. So when should someone consider seeing a pelvic floor physical therapist? My personal advice as your biomedical engineering big sister is you don't have to wait until symptoms become unbearable. If you've experienced persistent painful intercourse, urinary urgency, burning despite negative urine cultures, pelvic pain, endometriitis, endometriosis, interstitial cystitis, pain after childbirth, constipation, difficulty emptying your bladder, tailbone pain, pain with tampon insertion, or unexplained pelvic discomfort or pressure, a pelvic floor assessment may provide information that no lab test ever could. That is my personal opinion. Like, it doesn't have to be something that you get a diagnosis for. Like, you can go and get an assessment. My biggest takeaway and biggest message that I want you guys to leave with today is that your pelvis is not just reproductive related and just reproductive in general. It isn't just urinary. It isn't just digestive. It isn't just orthopedic, neurologic, physiologic. It's literally all of these things at once. That's what I want you guys to understand. Your microbiome doesn't exist in isolation. Your muscles don't exist in isolation. Your nervous system doesn't exist in isolation. Your posture doesn't exist in isolation, and neither does your trauma. So women's health and female reproductive health has spent decades dividing these systems into different specialties, but your body has always known that they are connected. And maybe, just maybe, it is time that healthcare starts acting like what your body already knows. So thank you guys so much for listening to today's episode of Pelvic Floor Health and my take on pelvic floor therapy, because this is just something that's not talked about enough. And if you are someone who's been told that everything looks normal despite feeling normal, then I think that this video will be very insightful and you will feel like you learned a lot. Let me know what you learned. Let me know down in the comments below if you guys have ever done pelvic floor therapy and what your thoughts are on it. One of the biggest sentiments I hear is that insurance is very hard to get pelvic floor therapy covered. And I completely understand. If I'm being completely honest, I was in a position, and 4 or 5 years ago, I wouldn't have been able to do this, but in my recent adult life, I paid for physical therapy, pelvic floor therapy, all out of pocket. To say it's not pricey would be a lie. That's unfortunate, because I wish that pelvic floor therapy was so accessible. So I do want to acknowledge, because I feel like so many people will leave hearing this episode and say, well, goddamn, I want to do pelvic floor therapy. It sounds like I should be doing it. And then they go reach out to the pelvic floor therapist and things like that and realize that their insurance doesn't cover it, or maybe you don't have insurance because insurance in this country sucks. Or I'm in the United States, by the way, if anyone's watching this who's not from the States. But all of that's to say that I don't want you guys to be blindsided to find out that pelvic floor therapy is often paid out of pocket. If I'm being transparent, I would have never been able to do pelvic floor therapy 4 years ago. I only started doing it within the last 2 years because I had the financial capability to do so, because I knew that it was going to be an out-of-pocket expense. But I was never able to do that in the past. And it's unfortunate, and things should change, because pelvic health and pelvic floor therapy is so important for female reproductive health, and it's not talked about enough. And I hope that one day that changes, changes. I hope that my advocacy for pelvic floor therapy does help move things in the right direction so that it's not something that's just approved after childbirth, but it's something that's recognized to be useful after recurring infections or painful intercourse or pressure, or people with endometriosis. Like, all of these different conditions and situations deserve a pelvic health assessment. So I hope that this video was helpful and gave you a lot of hope that you can get better. And if you cannot access a pelvic floor specialist / therapist, my advice is go on YouTube and watch some pelvic floor exercises that aren't Kegels. Look at some relaxation and get you a ball, any type of ball. Find some pressure points and you can lay on the ball and try to release your different pelvic floor muscles, your iliacus. You can try to loosen up the glutes. One of the best things that I did was get a tennis ball and try to rub my glute on it and find a sensitive like trigger point. And then I would just rest my glute in it to relax those muscles. So find trigger points, find those muscles, try to loosen them up. There are things that you can do at home. If you guys do want me to make like a TikTok video on my favorite like pelvic floor exercises, let me know. I do have videos from the past that I did. If you guys want more, let me know. So I love you guys so much. Thank you for tuning in for this episode, and I can't wait to see you guys in the next one. Bye guys.